if as long as they are willing to be a recipient of it.
And when we're talking about financial abuse and neglect and physical abuse, you know, we work with caregivers on a daily basis, and we try to encourage them that it's okay to spend your parents' money on their care. It's not okay to misuse their money and go to Florida or pay your own rent or whatever, and then not have the money to pay for care, or to not want to make sure that they're safe in the home because you don't want to spend the money because that's your inheritance. That's where the neglect comes in. But you know, you had mentioned physical abuse too, and it is very stressful. Nobody wakes up one day and says, you know what, I want to be a caregiver. It just happens. It can happen overnight, it can happen gradually, and like Rebecca said, it's very stressful. I mean, to care for somebody, to even look after somebody periodically, it is very stressful. So we really encourage family members, and when we're talking about caregivers, we're talking about family members, friends, to take advantage of the services and the opportunities that are there for respite. And part of our partnership with the Adult Protective through our Broome County DSS is to help put in services into the home to support the caregivers and the seniors in the community so that we can help prevent some of these abuse situations that we're talking about.
No one probably plans ahead. You know, sometimes you don't realize that your relative or whoever has gotten to a point where they need that kind of care. And you mentioned, Rebecca, education previously, and I thought that people don't go to school to do this except as professionals, but what happens when it's time for someone to look out for me? I'm hoping that there's going to be some resource to help them know how to appropriately take care of me as I grow older.
Well, that's where the Office for Aging comes in New York Connects, which is a long-term services and supports for anybody of any age in the county. And you can call, you can get a hold of Rebecca, you can get a hold of anybody by calling, you know, into the Office for Aging. And we work with multiple communities to help connect people to the resources. But you had mentioned planning, that was one of our bullets that we had talked about. I mean, to really have the community help with these issues that we're talking about. As an older person yourself, you should come up with a plan. You should be talking to your family about, if this happens to me, this is what I would like to see done. If this happens to me, this is what I don't want to see done. You really should plan ahead. I'm thinking about what my plan is already. I think, oh geez, you know, we run into a lot of people that have outlived a number of people. You know, I had an aunt that lived to be 105 in her own apartment. And she mentally was fine. Physically, she started to deteriorate, and she did, you know, lose her eyesight, which, you know, did make her have to move out of her apartment eventually. But the whole plan was, you know, she wanted to stay there as long as she could. And she would tell you, I have outlived, she was my great aunt, most of her family, all of her friends. And, you know, she even joked and said, you know, my husband's thinking that I went the other way because I've lived so long. But, you know, she did have a plan, and sometimes the plans have to be changed, but, you know, to encourage people to help with the whole abuse, whether it be neglect, self-neglect, financial neglect, that, you know, if you've got a plan that you can voice, then it really does help.
We think about advanced directives when it comes to our medical care, and we have many people have financial plans, but the plan to age and to think through all the different things that might happen as we grow older, that's a plan that most folks don't talk about.
Yeah, and that's actually, I run into that quite a bit through the Ombudsman program, because you can have healthcare proxy or power of attorney, but people will say, well, I'm power of attorney over my mom or dad. And they don't realize that's financial. That's just financial. And then they'll say, well, I have healthcare proxy. Okay, but is it enacted? And it takes quite a bit to have it enacted. You know, a physician has to deem that the person can no longer understand the consequences of their decisions. And I do run into that, where sometimes it's a little easier to ask, you know, a facility might ask the kids, we're going to go ahead and have this treatment done on your mom. You good with that? And they'll say, yep, that's okay. but really they didn't ask the resident, and it's supposed to go to them. It's their, it's treatment for them. You know, we'll have these care plan meetings, and I'll get ready for it, and the resident's not there, and I'm like, where's the resident?
The empowerment is missing from.
Exactly.
Yeah.
You know, they're still perfectly capable. It's their lives, and sometimes because children are having a hard time, or family members are having a hard time with that piece of it, I have to say things that are uncomfortable. And one of the things that people don't realize is, you know, well, why can't APS go in and take someone out of the home if it's abusive? Yeah. Well, if the individual understands certain situations and they've accepted that, it's their right to continue to live that way. And if someone in a nursing home says, I don't want meds anymore, I don't want any treatments, if I stop eating, then I stop eating, and you know, and they understand that, then I have to say the uncomfortable sentence which is, it's their right to fail.
Yeah.
Because it is their right, and sometimes people want to jump in and try to change that because it's uncomfortable, they feel guilty, it's not something that they would want, but for the individual it's correct.
Sure. Let me remind our audience that our guests are Rebecca Bradley, who's been just speaking there about these issues, Assistant Director of Action for Older Persons, and then Lisa Schuhle as the Program Manager for the Broome County Office on Aging, Office of?
Up for Aging. We answer to everything.
Okay.
And most people think we're the same thing.
Yeah,
yes,
right,
yes,
right,
they do.
right.
Two different agencies. We work very closely
We really do,
together.
yeah.
And that's so helpful. I mean, we
Yeah.
call that networking or partnership
Yeah.
or whatever, but that's a strength of the community is when the right hand knows what the left hand is doing.
Absolutely, yeah.
Yes.
Suppose someone sees something. You know, we say if you see something, say something in other areas of our community life. Suppose you're aware of something that's going on that just doesn't seem right, and you don't know quite what to do about it. What next? You know, whom do they contact?
Well, they could call the local Adult Protective Services Department at the Department of Social Services, or they could call the Office for Aging, because we do work in partnership with them on many things. We actually do the prevention and the outreach in the community, and they take the actual abusive cases. So they could call either agency. They could call really anybody. A lot of times we get referrals from, if there's been repairmen in the home even, or neighbors, they'll call in and say, you know what, this gentleman, you know, didn't look like he had any food in the house, and, you know, or something like that. And we can send out a caseworker to check on the person and to try to put in some services and supports, maybe work with them and their family. A lot of times, a lot of the people in this area have all their kids or their extended family have moved away, and they don't want to bother them. They don't want them to know that they're struggling. You know, we also get calls from some of the banks or other agencies. Even some of the drugstores will call and say, you know, this lady was in here, she's very confused, she didn't really know what was going on, we're really concerned about her, and we can try to track her down and go out and see if there is anything that we can help her with.
I served a church where it was a paper boy, I guess a paper delivery person, we would say these days. But the newspaper was always taken in each day, and a couple of days the paper was still there. And so this person took the initiative to say, we need to check on this person. And they found her on the kitchen floor, and she went to the hospital, she survived. But that was someone who just realized something wasn't quite right, and followed up on their instinct.
Well, that's great, because, and then after that, we can also go in and help. Maybe they need an emergency button. Maybe she does. That's a perfect example to push later on. Or maybe she needs some extra help. Maybe, like Rebecca had mentioned, she wasn't taking her medication right, and that's why she had maybe just passed out if she was a diabetic or wasn't eating correctly. So all the agencies in the community really do work together to try to keep the older people as safe as we can. But you really should, we encourage everybody to call in and to take an active role in helping prevent some of this, either self-neglect, neglect from other people, or the physical abuse also. You really should report it.
Let's talk about a website where folks can go, because a lot of people are anxious to go to the web and see what resources are available. So we have the gobroomcounty.com/senior. So that's all one word, gobroomcounty and then .com frontward / senior. And the phone number is 607-778-2411. And that's, again, 778-2411, and that's the Office for Aging. And then there's also actionforolderpersons.org.
It's aggressively long, we know.
Yes. So you better enter that, very carefully. Actionforolderpersons.org, and we'll give the phone number there too. It's 722-1251. 722-1251, and the phone numbers are all 607 area code.
Yes.
So that's helpful to know for the future.
Yeah.
So whichever agency you call, we'll be happy to direct the caller into the right place and to try to do what we can for everybody.
Are there any events or training things that go on, classes that folks can go to that are happening?
Well, we have caregiver services through the Office for Aging, and we offer a lot of different education programs on a monthly basis for people. We've got an event coming up in December. I can't recall the date right now, but you can get it off the website or you can call in. And we are actually going to have a social worker there that's going to talk to caregivers about stress in the holidays, stress caring for somebody, some ways that you can alleviate that.
Very good.
To help prevent so that you can cope better with caring for. And it's not just sons and daughters, but a lot of times it's spouses that are caring for each other that can be very stressful. Or there's caring partners. We run into a lot of that where the husband and wife are actually together, they're managing.
Right.
They're one unit. If something happens to one of them and they end up going in the hospital even for a few days, that link is broken and that other person can really struggle.
Yeah.
Maybe the husband did all the cooking because the wife physically isn't able to anymore. Then all of a sudden, what happens to her if she's left home alone?
Yeah.
So the services don't have to be long-term that are out there for everybody. That's, I think, one of the misconceptions is people think that, oh, if I get Meals on Wheels after my surgery, I'm going to have to take it forever.
I'll never cook again.
Yes, that is not the case.
Yeah.
Independence is what we all want for everybody.
Right. Thank you both for being here. I know we could go on because this is an important
Big
issue,
topic.
and we'll have you back. We'll have to do this again.
Thank
Lisa Schuhle is with the Broome County Office on Aging, and Rebecca Bradley, the Action for Older Persons. And don't forget that if you do see something in your community and you think that maybe there's something you could do to help, there probably is something you can do to help. So check out the web pages and do what you can to bring some comfort and some security to our most vulnerable senior citizens. I'm Jeff Kellam, thanking you for being with us on this Encounter program and hoping that in the coming week you'll be gentle with people and with yourself.